Welcome to Baby Mama's Wellness Podcast, the home to holistic care and support for babies and mamas.
Okay, welcome back to Baby Mama's Wellness, the podcast. I'm your host, Dr. Rachel Owner, and today we have a very special guest joining us. I'm thrilled to announce Dr. Heather Elford, a naturopathic doctor, birth doula, and friend. Dr. Heather and I started the naturopathic schooling together, and we both were on the pediatric shift. And now she's working as a brilliant naturopathic doctor, and today she's going to share some incredible insights on pregnancy. So without further ado, welcome to the show, Dr. Heather. I'm so happy to have you here.
Thanks so much. I'm so excited to be here.
So exciting. I can't believe how far we've gone. I know we're only like 1 year out, but we've both done amazing things. So I'm so excited today to just talk about your journey with naturopathic medicine and as well with pregnancy.
Yeah, sounds good.
Okay, so our first question is, what inspired you to become a naturopathic doctor and what is your focus?
Yeah, I think that I'm maybe one of the unique people who kind of knew from a young age that they wanted to be a naturopathic doctor. I grew up in a family where my mom was a chiropractor and she did like homeopathics and herbs and like a whole bunch of acupuncture stuff like that. So I just like knew at a young age that I really wanted to be an ND. But then for me, like once I started going through some of my own health concerns, particularly some period concerns, hormonal stuff, feeling super fatigued and burnt out, especially through school, when I was working with an ND, like I felt like night and day compared to how I was before and then what I felt like after starting a treatment plan. And I think that just like really sparked so much like love and passion for me of supporting women, especially, and supporting a lot of hormonal concerns. And then from there, I just kind of fell in love with like pregnancy and postpartum support. And of course, when we were on the pediatric shift too, I just fell in love with also taking care of babies and littles. So definitely in my practice, I see a lot of hormonal concerns, a lot of women's health, and then pregnancy, postpartum, patients trying to conceive, and then seeing their babies after.
Oh, that's awesome. I always tell, I think I was talking to Dr. Tara last week when I saw her, and I was like, Heather, I'm so excited to have her on the podcast. Like, I remember her being on the pediatric shift, and you were so booked and busy, and you were so amazing. And I like, Heather is like one of the smartest people I know, and I know your techniques are in such amazing hands. And it's so
Oh,
awesome to see like where you've kind of navigated to and your journey. And you are one of the few people that kind of knew about naturopathic medicine early on. So it's kind of cool to see how your journey has gone. And I'm so excited to see where it's going to go to.
yeah. I mean, it feels crazy that it's only been a year, but we've learned a lot this year.
It's definitely been a game changer.
Yeah.
Okay, so my next question is, what advice would you give to a woman who is pregnant and looking to have more of a natural approach to her health and feels unsure about the methods or whether they're safe or not?
Yeah, I would say my biggest piece of advice is to work with a practitioner that's well versed in all of that because there is a lot of confusion. And I feel like even in pregnancy itself, like there's a lot of things that you're unsure about. There's a lot of questions you have, a lot of anxieties that come up. Even if you are familiar with pregnancy care in general or you've been pregnant, there's just still so much information and misinformation out there. And it can be really overwhelming to navigate. So I would say like finding somebody like a naturopathic doctor, like a midwife, somebody that you feel like you really trust, that you can bounce those ideas off of, and say, hey, like I heard about this thing, or I'm looking for some more alternative options that you'd be able to get their advice on. Because otherwise, trying to navigate that yourself or like trying to be your own provider in that just adds so much to the anxiety that can happen in pregnancy naturally.
Yeah, for sure. What advice would you give to women that kind of, because I know Dr. Google is a big thing. Is there any resources? Because it will never stop people from really going online to look for help.
Yeah.
No, I do agree with you finding a provider. Is there any like online resources that you would recommend?
I think there I mean, definitely like following practitioners that are talking about like pregnancy. Like I think of you in particular. You're sharing a lot of really amazing resources in pregnancy. But honestly, like I would personally say for me, I just defer to my ND because I have so many questions, even for myself, even though I know, but I'm like, I just can't like fight that overwhelm of how many other resources there are. And so I really do like having that one-on-one and asking people questions that way.
I agree. I think when my time comes, I probably would get a doula. I'd probably see an ND. Uh,
Yeah.
as even online, it's not all of the information is always accurate. So I do agree that sometimes it's best to go and find a provider that knows what they're talking about.
Yeah. And that it's like more individualized to you as well. Like obviously there's really great pregnancy apps out there, like what to expect when you're expecting, like the bump, like there's things like that that are kind of fun to follow, but at the same time you're going to have questions that are specific to you, and that is like no online resource is going to be able to answer that for you. So being able to have a practitioner that knows your history, knows what you're going through, like that takes away a lot of the mental burden more than anything else, more than Dr. Google.
Sure. How can couples support fertility together? Are there any naturopathic practices that they can implement to support their journey?
Yeah, I love this question because I always say it takes two to tango. Like you need both the male and the female factors to be in really good place and good health to support optimal fertility. And so I'm telling this to my patients all the time too, because I think often I'm seeing women or the person that's going to be carrying the baby coming in and doing all this work and helping to support their hormones and helping to support their bodies. But really, we do see, and there's been some more recent research too about how the male sperm actually can impact placental formation. And so it's really interesting to know those pieces and not so much to say like, okay, all of the attention is just on the woman, but to be able to say like, look, this is something that we're partnering in together, and it's really important that we're both in our best. So I usually say like, diet, exercise, like let yourself be at a really good place health wise in general. And then, of course, like specifically for males, avoiding things like hot tubs, not having laptops on your lap or phones in your pockets when you're actively trying to conceive. Obviously, those things can be really important and helpful. And from both sides, too, like watching your intake of alcohol and of smoking during that time that can impact a lot of like our antioxidants in our bodies and when we're trying to conceive. And then specifically, if there are things that come up where we're doing some additional testing and we see things that maybe could be supported with like sperm quality, motility, things like that, there's lots of really lovely evidence-based supplements and options that we have to support the male factor too. So it is fun to like do it together and like get that support together and like work on your best health at the same time.
Yeah, I agree. And I also like the fact that the individualized piece, because I mean, there's certainly a lot of supplements that you can give to kind of help with fertility and improving fertility, but sometimes they're not effective if it's not the supplements that you need. And so I do like testing and making sure that, you know, we're giving you exactly what's going to help boost fertility. And then all of the things that you said, diet, exercise, is the key thing, reducing alcohol, even reducing, you know, smoking, weed. Because I feel like some people, they're like, oh, I don't smoke cigarettes, but they do smoke weed. And there is studies that have found that even marijuana use can affect sperm quality and even egg quality as well. So yeah, I definitely agree with all the things that you said.
Mhm.
Okay, so the next question is, in your experience, what are the top five naturopathic remedies or practices you would recommend before, during, or after pregnancy?
Yeah, I like this question because I really had to think about it. I was like, okay, I can only pick five. What are the top five? I feel like there's so many things that we can do. And like as naturopaths and as doulas, there's so much support. I would say to start for sure in the trying to conceive point of view, having a really good high quality prenatal is like a must. And so for me, that looks like making sure you have enough folate. I'm usually aiming for about 1 milligram of folate within a good high quality prenatal, ideally in a methylated version in case there's an MTHFR gene mutation that we don't know about. And then making sure that we also have good amounts of choline too. So some of the prenatals out there are going to have choline. Some of them I'll add on onto somebody's prenatal. But with a good quality prenatal too, especially in trying to conceive, I'm recommending my patients start that 3 months before trying to conceive, because especially once you get either like first in the first few weeks of pregnancy, either you may not know that you're pregnant right away, and those nutrients, especially like the folate, the choline, are so critical for neural tube development, for the development of the baby, especially in those first few weeks. And for anybody who has been pregnant in the first trimester, you don't always feel like taking your prenatal, or you don't always feel like eating really good quality nutritious food. So being able to have a lot more of those nutrients in like good storehouses in your body beforehand, doing that 3 months before, that can be really, really helpful so that you're not walking into pregnancy in a really depleted state. And I'm always telling my patients to keep going with their prenatal, even up to 3 months postpartum. Sometimes I'll even keep them on for longer if we are like they're feeling quite depleted, and we need to support that in postpartum too. So that's number one for like trying to conceive before pregnancy. And then this one is not like specifically naturopathic, but counseling. I think it's something that is what I've kind of come to realize in the last few months too, that I recommend it to all my patients when they're starting a fertility journey as well. I think there's a lot of things that come up within a fertility journey, whether you're in the process of trying to conceive, whether you're in the beginnings of pregnancy and postpartum. There's so many emotions that can come up and so many kind of different things that you're going to feel. And so having a counselor, having a therapist, having somebody that you feel you can talk to about all of those emotional factors is so, so important and so critical for your health overall. And then also just helping a lot with your nervous system regulation through pregnancy. So that's a big one. That's definitely something that I'm recommending to all my patients now. And then definitely like towards the end of pregnancy. So once we get into the third trimester, things get a little bit more exciting. There's a lot more like movement. We're seeing our patients a lot more often because baby's growing so much, you're growing so much. And so one of my favorite things to use is acupuncture, which is not surprising for Rachel. I feel like I used acupuncture in clinic all the time, and I still do. But I love it. I love there's some good research on it and being able to support labor outcomes, being able to reduce C-section rates, induction rates. I've seen how much it just helps to relax moms too. And sometimes like moms are just lying down on the table and they're like, this is the first time I've done this like in the last week, is just like calm down and like have some moments and some time for themselves, because there's a lot of craziness that kind of comes up in that third trimester. So I love using pre-labor acupuncture for patients. Acupuncture is also really great throughout pregnancy too. If there's digestive concerns, like sleep concerns, anxieties, like acupuncture is just so versatile, and I love using it in practice in general. So that's probably number 3 for me. Number 4 is herbs, kind of a big, broad topic. But especially like using herbs a lot. I do that a ton in pregnancy in general, being able to support with labor prep, things like red raspberry leaf tea, which I feel like a lot of people know about. But there's some other lovely herbs that are really good for helping with labor, helping support labor, helping with nervous system calming, and then also helping with breastfeeding support too. So I use a ton of herbs in practice, especially in pregnancy. So that's number 4. And then number 5 is blood work. I run a ton of blood work in practice all the time. I feel like this is something that I've been like getting up on a soapbox about lately, is like blood work in the postpartum period, especially. Because I'm seeing so many of my moms in practice that are coming in and they're like a year or more postpartum and they've not had any blood work run on them. So often what I'm seeing is that like all the attention is on mom in pregnancy. Everybody's just checking up on mom. And then as soon as the baby's here, it's like, okay, now we're focusing on the baby, and mom often gets missed in that point of view. So that's definitely something that I use a ton and recommend always in practice. Even like before in the trying to conceive period, I love doing a lot of thorough blood work on my patients, helping to support them as best as possible so they can have their best chances of conceiving conceiving and having a really healthy pregnancy. But then especially in postpartum, I'm running a lot more labs than I think other people may be.
Yeah, that's amazing. I love the top five. Definitely my top five as well. Um, I did have a question because I know you said good quality prenatals. What would
Yeah.
you say is a good quality prenatal? Because I know a lot of OBGYNs or family doctors will recommend certain brands or certain prenatal vitamins that you can get from the pharmacy. Why should they pick what a naturopath would recommend versus what their OBGYN would give?
Yeah, I mean, without giving any specific brands, just
Yeah,
because I
for
can't
sure.
give any medical advice.
I know,
I
trying
would
to be so
say,
careful there.
I know, I have like specific high quality prenatals that I would recommend in my patients, but really what I'm seeing is that it's challenging in the sense that sometimes these prenatals, if they're recommended by a doctor, are covered by benefits. And so I understand why patients may be choosing that. But what I'm seeing a lot in some of the prenatals that I'm recommending for my patients versus other ones on the market, I'm seeing a lot more fillers in those other products. I'm seeing dyes. I'm seeing things that are just like not amazing that we don't necessarily need to have, and seeing the actual nutrients like our B vitamins, like things that are going to be really supportive in pregnancy in such low doses that I'm like, that's not even going to make a clinical difference for you. You're not going to feel any different from that. You're really not going to get those nutrients in their most absorbable and bioavailable forms. And so having a high quality prenatal where, yeah, you're going to be investing in that, but it's also a worthwhile investment for you to feel like you have better energy throughout your pregnancy. You know you're getting those nutrients. You know baby's going to be thriving from those nutrients as well. For me, that's really important, and that I have those options for my patients. So ultimately, they just have the healthiest pregnancies possible.
Amazing, amazing. Yeah, I agree. I think the top thing as to why I recommend certain brands over the pharmaceutical ones is one because the fillers, I think it's one of the biggest reasons, but then also the dosing. And then I also find some of them, the iron inside can be quite constipating, has kind of affected my patients. And so they're like, oh, I don't want to take my prenatal vitamins at all. And I'm like, oh, no, you need to take something. And so that's when I tend to recommend a different prenatal as well.
Yeah, definitely.
Okay, so the next question is, can you share a little bit about your personal journey with pregnancy and what was your experience like? I'm so excited to kind of hear your journey in pregnancy. And then once again, I just want to say congrats.
Yeah,
So
thank
happy.
you. Yeah, so I'm at the time of recording, I'm currently 16 weeks pregnant. So this is my second pregnancy, but my first baby. So we're going to dive into all those pieces. But yeah, definitely in pregnancy so far. I'm now into the second trimester. And it's lovely to have some more energy back, to be feeling a little bit less nauseous, all of those things. So I feel for me, like I have such a different perspective in this pregnancy, having had a pregnancy loss before. Even though I've been feeling tired at times, sometimes I'm like sleeping 12 hours a night and then was having like 2 to 3 hour naps in the day, more so in the beginning of pregnancy. And then like experiencing nausea, aversions, all of those things. Like my perspective on it is so different because I'm just so thankful that I get to carry this baby and that I get to have this pregnancy. So even the first time that I puked in this pregnancy, I didn't have any symptoms in my previous one. So this time when the first time I puked, I told my husband and we both were like, yay, that's so great. Because it's a good sign that like the beta HCG levels are like rising and everything is good. But yeah, it's a different perspective. So I'm thankful for more energy, but even if I was sick the whole time, I would have been thankful too.
Yeah, that's awesome. Congrats. So I know you did say that this is your first, like your second pregnancy, but your first baby. So I do have questions regarding miscarriage. What emotional or physical challenges did you face with your miscarriage process, and how did you cope with those?
Yeah, I would say so. We had a miscarriage earlier on in this summer. We found out that I was pregnant in June, but then a few weeks later, at 7 weeks, we lost the baby. And so I would say it was honestly one of the hardest things that I've ever been through. And I think it's important to not overlook like the male piece of it too, because it was a huge loss for my husband as well. Anybody knows him knows that like he's wanted kids forever and he's going to be just the best dad in the whole world. So both of us were like really, really grieving that loss, and it was really challenging. And I think part of like why it felt so challenging for me was I never expected that would happen to me. I was like, oh, I'm a naturopathic doctor, I'm a doula, like I focus in pregnancy, I'm doing everything right, I'm taking all the right prenatals, I've like done all of the work ahead of time. And so I never expected that a pregnancy loss would happen to me. And it did. And so I think that was just very shocking. Like I think I was very shocked for a little while and a lot of disbelief. And yeah, that was definitely like very emotionally challenging. We, both of us, my husband and I, took some time off of work that week that the miscarriage happened, and we both just like went up north to a little cottage and we just spent that time together. And that was really, really important for us. Just, we told our friends and family who we told about the pregnancy already and just said, like, we just want to let you know that this happened. We just need a little bit of space. But we just took that time and we cried together. We like sat together, we just grieved together, and that was really important for us. Yeah, and so going through like a lot of that healing journey since then too, like a big part of that has been having good community, having practitioners that we're working with and supporting us in that. And yeah, we're at a much better place now, but of course, like it still comes up sometimes, even like within this pregnancy too. We're still thinking about that loss and grieving that loss, and it'll always be part of our story.
Yeah, for sure. And you touched upon a really important point, that you are a naturopathic doctor, you are a birth doula, you work in this field, you've done everything that you can, and you still had a miscarriage. And I think a lot of women have a lot of guilt during pregnancy when they do have a miscarriage, and sometimes it's just not the fault of the male or female. It's just one of those processes, and sometimes when your body detects that maybe the baby is not going to be viable, that's when a miscarriage happens earlier on. And so I'm glad that you were able to share your experience, because I think a lot of people will learn from you and kind of, have a little bit less guilt from your experience. Um, and I'm just so glad that at least, this second pregnancy is going well.
Mhm. Yeah, I think that guilt is like an important thing that just to be aware of too, because there were moments that I had that too. And I think like there were moments that I had those questions that came up, and they're very like natural questions that can happen when you have a loss of being like, was it something I did? Is there something wrong with my body? Am I ever going to be able to be a mom? Like, is that just not in the cards for us? And so I think like for me, it was important to process those thoughts but not keep them, like not let them linger for a long time, because and then of course like we may talk about this later too, but then working with practitioners to help me realize like, okay, like we did some other testing, we took a look at some other things, and there wasn't anything in particular that pointed to why the miscarriage happened and why we had that loss. And so that gave me some peace, even from a medical perspective, of being like, okay, there's no reason that we can't try again. So that was helpful for me in that process too.
Amazing. And I also like how you said the male aspect. I'm currently doing a genetic course, and one of the weeks we kind of touched upon, the male perspective of like, genetic issues. And it really gave like a really great insight. It was a book called Anna, and it was basically she passed away really early on. And, it was like the male side of, infant loss. And I had never really thought about it in that way, because I usually only see women. So I was like, oh wow, like yeah, there is quite a big piece that isn't really addressed. And males tend to not be treated for depression and stuff like that. So I like how you also touched upon that as well.
Yeah, yeah, I think that is really critical. And I mean, everybody experiences it differently. And I've spoken with other people who have experienced pregnancy loss, and there's different feelings out there from both sides. Like sometimes, like some experiences are that the husbands are like ready to move on and try again right away, and the other partner isn't always feeling that way. So, like, I just felt very thankful that my husband and I were both on the same page and we both felt the same, like we both really grieving the loss, and he understood the loss as deeply as I did, and then we both just felt good about the timeline for trying again at the same time. So I was very thankful for that, and part of that was us also doing therapy together in that process too, so that was helpful.
Amazing, amazing.
Mhm.
I love how you also said that you noticed some differences from the last pregnancy to this pregnancy. Do you want to delve in
Mm.
a little bit more about your pregnancy journey right now? And like, I know you said that, some of the symptoms of like nausea and fatigue. Is there anything else that we should kind of watch out for in the first trimester or second trimester?
Yeah. Yeah, it was interesting. So basically, from working with some of my practitioners, we kind of figured that most likely the loss that we had was a chemical pregnancy, which indicates like essentially that fertilization happened, but actual implantation likely didn't. And so that kind of lined up with a lot of the symptoms I was having, in that I wasn't really having that many symptoms. I was obviously having like higher levels of the progesterone, like was having at least some of the beta HCG that was showing up, because there was fertilization that happened. So in that, I was getting things like breast tenderness. Like I wasn't necessarily feeling a ton of mood changes, but obviously I'd missed my period by that point. But when we had done some pregnancy tests, the lines were really, really faint in our first pregnancy, versus in the second pregnancy, this time that I'm in now, almost like right away, I was feeling like a lot more symptoms. So before we'd even tested, I was like running to the bathroom a lot more frequently. I was just definitely feeling that breast tenderness. I was feeling a little bit of like cramping, which is like a very normal sign in the beginning of pregnancy as implantation is happening. And so before we even tested, I was like, I'm pretty sure that like I'm pregnant and this feels very different. And so then pretty quickly, even within like the 5 week mark, I was feeling nauseous. I was throwing up within this pregnancy, but I didn't have any of that in the first one. And so that was part of like what was really helpful for me in this pregnancy too, to be a little bit less anxious, of just feeling like, okay, I'm feeling more symptoms. That's a good sign. That's a good thing. And so often with a chemical pregnancy as well, you won't be feeling a lot of that nausea. You won't be feeling a lot more of those pregnancy symptoms that you think about, the aversions, cravings, things like that, because the beta HCG levels aren't climbing up to high enough levels where we're seeing a lot more of those symptoms happening. So that was like some of the differences between both of those pregnancies for me.
Thanks. Thanks for sharing because I honestly didn't know that. And I was curious when I was like kind of going through my questions. I was like, okay, how would you know the difference? Or is there any way that you'd feel less anxious? So that does give like amazing
Mhm.
insight into that.
Yeah. And if you're listening to this and you're like, oh my goodness, but I'm pregnant, I'm not feeling any nausea or anything, like that doesn't necessarily mean that anything is wrong. That was just my experience. And that is a typical experience that can happen with a chemical pregnancy. But often with a chemical pregnancy, like you'll get a positive pregnancy test and then maybe a few days later have your period or like start menstruating again. So it's not, it doesn't like it looks a little bit different in every situation.
For sure.
Mhm.
Okay, so my next question is, for many, miscarriage can be a deeply isolating experience. Did you feel like you had support from family, friends, or healthcare providers during your journey?
Yeah, yeah, definitely. I actually don't know how we would have gone through it without our support system. We have some really amazing friends that feel like family to us that were really supportive in that process, and our family was really supportive. We were obviously very excited, and so we told a lot of like our close loved ones right away. So that was, that was helpful in the sense that we knew that they were there to support us through that. And honestly, for like a lot of them, there wasn't anything that anybody could have said or done, except like on the day that we had the miscarriage and we were at the hospital for the day and emerged, just getting tests done and seeing like if that was what was happening. Our friends like dropped us off food that night for dinner because we didn't want to make anything, and they sent us money to get meals, and like those were really, really helpful things in those like early stages of like going through that loss. But then afterwards, like there were times that our friends and our family would just sit with us and nobody would say anything, but they just cried with us. Like they felt that loss with us too, because they were also excited for us and being able to have this baby and have this pregnancy. And so yeah, we had a really, really good community and support system, and I'm very thankful too to have had I have a lovely relationship with my family doctor, and I have a naturopath as well that I'm working with. So I feel like I had really good practitioners that were supporting, and a therapist. So we had a good like team of people, which is also why I recommend that so much. Starting a fertility journey too. Not that you should like go into a fertility journey thinking you're going to have a loss, but to be able to have that support system so that if anything happens within your pregnancy, in your fertility journey, whatever that looks like, then you do feel you have that support. And I think for us, like we really had to decide in this pregnancy whether we would tell people or not, because it was hard to tell people that we'd had the loss. And so we were just unsure. We were like, what do we do? Should we be telling people? Should we not? And I think we just realized how much support we had when we had the loss, that we wouldn't want to go through a loss and not have that support. So we did choose to tell those same like individuals who were really supportive of us. Like when we were going through that loss, we told them about this pregnancy early on. And they've been really helpful in just like encouraging us through this pregnancy too. So we're very thankful.
Amazing, amazing. And I do agree. I think support is the biggest thing when it comes to pregnancy, and it's why I became a doula, because rates find that when you do have that support, pregnancy outcomes are a lot better. You are a lot more at ease. And that's one of the key things when it comes to your pregnancy journey. And like you said before, like seeing a counselor, seeing a therapist, having a doula, the main thing is being and feeling supported. So I'm so glad that you have an amazing team around you, friends, family, healthcare practitioners that can support you during your journey.
hmm And I did think a really helpful thing too was obviously like we have, I have some family members that they've experienced a loss as well, but a lot of the people that were our support, they didn't quite understand in the same way because that wasn't part of their experience, and like thankfully that wasn't part of their experience. But then speaking with other people who have had pregnancy losses, that's been a really helpful part of this journey for us too, and just speaking with people who'd even had their first pregnancy as a loss, that brings up a lot of other feelings because like you're wondering if you're ever going to be able to have a child. So that's been a really helpful part of that like community and that support. And the more that we've shared our story, the more people that have also come out and shared their stories. And we wouldn't have known about that otherwise. So that's been a really like lovely kind of part of this journey. I had one person tell me like, welcome to the sisterhood that like none of us wanted to be a part of. And I think that was like very healing for me too, being like, I'm not alone in this. And this does happen to a lot of people. And so being able to have those people that you know that they've experienced that loss and are willing to talk to you about it and share, that's been really helpful for our journey too.
Amazing. Okay, so my next question is, can you talk about the recovery process, both physically and emotionally, after a miscarriage? What are some of the things that have helped you heal?
Yeah, definitely that recovery process. If you've experienced grief before or you've never experienced grief before, it looks very different than what I think I was expecting. And so there would be some days where I felt a lot better, and then some days where that was a lot worse. And it was very non-linear, like every single day was different. And as I mentioned before, like even now, sometimes in this pregnancy, there's moments where I feel that grief and I feel that loss and it comes up. And sometimes things trigger it and you don't like it just kind of comes out of nowhere. And so that's okay. Like if that's part of what you're feeling too, that's also very normal. I know at one point I was asking my therapist, I was like, I don't know, am I just grieving or is this depression? And she's like, this is grief. Like, and having somebody like a practitioner who can help discern that for you and distinguish the difference is really important. But yeah, so in that recovery process, definitely for me, having those team of practitioners that I could be talking to, that was a really helpful process, especially taking that time with my husband. That was like one of the most important parts of that healing. And then us checking in with each other, even like months after, even now, we're still checking in with each other, being like, okay, how are you doing with this? Or something will come up, or we'll watch something and we'll be like, okay, are you okay? And so that's been really important and helpful. And for me too, like having something like a little memento, like I have a little necklace that is like the birth flower of June when we lost our baby. And I'm gonna, for each of our babies that we have, I'm gonna add like a little flower onto this necklace so that I kind of always have my babies with me. And that's been like a helpful piece for me. So I know other people that like plant trees or do some type of like ceremony or something like that. I think like because it's a little bit of an invisible loss at times and not everybody sees it, having something like tangible is helpful or has been helpful for me in that process too. And then slowly, like physically, just kind of getting back into doing things that feel more like me again. Definitely at first, I wasn't like feeling like I wanted to be doing all the nutrition things that I know I needed to be doing and nourishing myself well. And like exercise was challenging right off the bat. Like, so getting into those things again and starting to get more into doing things that I felt like more like myself with, that was helpful for like physically healing in that process too.
Yeah, that's good to know because I mean as you know, I've had like a history of family members that have had like infant loss, and I know it's very hard to kind of navigate that grieving period, and I love how you made like a memento for it, and that's very special. And I do agree. I do find that finding ways to kind of help your grieving process, if you have a support person, a partner to kind of help you go through it, that definitely helps. So I'm glad that, you've done something very meaningful, and thank you for sharing because I know that's very special to you, husband, and you're letting us into your window of what's happening behind the scenes. So that's very special.
Mhm.
Okay, so what are the biggest lessons you have learned in your practice that you feel other NDs and other healthcare practitioners should be doing or using?
Yeah, I feel like one of the biggest things I've learned is that your patients, like if you're supporting patients in pregnancy or fertility journeys, they may need more support than you expect. And so I think I felt that for myself. And then especially going through this pregnancy after having a pregnancy loss, like thank goodness for my ND. She's fielded so many questions. There's been so many things that I'm like, I know these things about pregnancy and I know them objectively for my patients, but I've like decided that in this pregnancy, like I can't be my own practitioner. I'm just like throw my little ND brain out the window for myself. And I'm like, I fully put my care into the hands of practitioners that I trust. And so I've followed up with her really frequently and like asked her lots of questions and have brought forth lots of anxieties. And she's been so helpful in that process of just calming me down. And there have been times that we've literally just had appointments and there's not any treatment that she has. We're literally just talking and she's talking me off a cliff. And so that's really important. I think especially for anybody who's supporting patients after they've had a pregnancy loss, especially if they're having another pregnancy, they may need some more support than you expect. And so that's definitely something that that I've kind of learned in this process as well. And then I think another thing that I found is really helpful too, working with my therapist, she's also experienced miscarriages as well. And so her sharing that experience with me was actually a very helpful part of my healing process too. And I know it's not something that every practitioner would feel comfortable to do or disclose to their patients or feels like it's always appropriate. But I would say if you feel like if that's part of your experience and you've had a loss and you feel like it's okay to disclose that to your patient, patients, from the patient perspective, that's been really helpful because I know that this practitioner really understands what I'm going through and they understand all of the nuances of how I'm feeling. And that's like been like allowing me to develop a lot more like trust and rapport with her as well. And then from like a clinician point of view as well, look into some of those reasons like why a pregnancy loss has happened. I think for me too, that was so healing and helpful to speak with my naturopath and her really analyzing a lot of like the blood work that I had in Emerge and all the symptoms that I had around the miscarriage, and her being able to say like, I think this was probably a chemical pregnancy, being able to have some answers. Like you're not always going to be able to have answers. But then even for me looking into like my progesterone levels, looking into some other testing to tell me, okay, was there something that was going on with me that would maybe impact my ability to conceive again or to have a successful pregnancy again? Like that was a really helpful part of the process for me. And so yeah, doing all of those tests were really, that was beneficial. So I would say if you're working in the pregnancy, fertility sphere at all, like do your research, do your due diligence, look into those answers for your patients. Sometimes you'll have those answers, sometimes you won't. But as much as you can like help and assure your patients in all of the steps that you're aware of, at least of the things that you can investigate, that can give patients a lot of like peace and reassurance as they're entering into a fertility journey.
Amazing, amazing, very insightful. So my last question is, given your experience as a naturopathic doctor, what kind of support do you feel is missing in the healthcare field that should be implemented?
Yeah, I think going kind of from the last question to like doing some more investigations, some more thorough investigations. I think I've been hearing a lot from my patients too that they're often going to be referred to a fertility clinic only after they've had two losses. Or like, of course, if they're having difficulties with conceiving right off the bat, having difficulties like in the first year, things like that. But it's like after having one loss, I'm like, I would want additional support if needed. So I think being able as naturopaths, especially, that we can really excel in this sphere as well and helping to support patients, doing some more of those thorough investigations. That's something that I'm doing a lot more with my patients. So looking into things like their progesterone levels as they're trying to conceive so that we can try to mitigate some of those potential opportunities for losses. That's one of the places that we do often see, even when patients get referred to a fertility clinic, a lot of times they're given progesterone as helping to support. So that's something that I'm looking at a lot more quickly with my patients. Especially if they are in that process of trying to conceive as well. And so, yeah, I'm also doing a lot more investigations with my patients in that preconception period in general. So not just progesterone, but looking at their immune status, looking at liver, looking at insulin, looking at some of those factors that could impact a potential loss. I would say that's something that I've been doing a lot more in practice, and I think other practitioners definitely can be doing those things too. Almost like not letting patients know that that's your perspective is like, I'm trying to prevent you from having a loss, but going into pregnancy as much as possible, having that good information, having that that health kind of established right off the bat, and having those investigations right off the bat. So I would say that, and then definitely more frequent follow-ups. So as I mentioned too, like especially in the postpartum period, a year postpartum is not the only time that you should follow up with your patients. So I'm following up with my patients a lot more frequently. At minimum, I love to follow up with them at like the 6-week mark, even if it's just for a virtual visit, check in, repeating blood work at the 3-month mark. We're at literally the max at 6 months, and then making sure that we're supporting patients in that period because it does often get overlooked. And I think that's a really important place that especially us as naturopaths as well, like we can be following up with our patients in that time and supporting them with a lot of different things, even from like herbal approaches, checking in with their mental health. There's a lot of things that we can definitely be supporting our patients with.
I agree. I love both points. One with following up, because I find a lot of patients, they don't know that they can have somebody to go to during that period, especially postpartum. one of my big things is postpartum anxiety and postpartum depression, and it can totally be minimized or prevented with naturopathic care. So it's one of those things that I always try to get people to come in, like you said, doing follow-up lab work, just making sure that all your levels are okay. If there's any underlying conditions that could be exacerbated, I mean, there's so many hormonal changes during and after pregnancy, and your body's trying to normalize. You've just had like a big change, your physiological change, mental change, a new person's around. So, you need to be supported, and you definitely need to go and, make sure that everything is okay, everything is balanced. If there's any deficiencies or excesses that we can kind of help treat. So yeah, I love that you touched upon those two things. And I do think as naturopaths, we shouldn't shy away. Yes, we're not primary care providers during pregnancy, but we can do a lot of supportive care during, before, and after pregnancy.
Yeah, absolutely.
Yeah, so that's the end of the podcast. Thank you so much for joining. And yes,
Yeah.
I look forward to working with you a bit more on pregnancy, hopefully in the future.
Yeah, thanks for having me.
Amazing.
Thank you for tuning into Baby Mama's Wellness Podcast. I'm so excited for you to be a part of the Baby Mamas community. If you like this podcast, hit subscribe to hear more. You can also follow our Instagram page at Baby Mamas Doula or visit our website at babymamasdoula.com.